I've been talking to you lots about the effect of the coronavirus on pregnancy and fertility, and this remains a very dynamic situation where we're monitoring it really closely because guidelines are bound to change in time. We just don't know exactly when, so it's really important we all remain up to date with that. But what I wanted to do was a basic discussion about coronavirus, what it actually is, how it causes disease, how it compares to the flu, because I've heard lots of people comparing this disease with the flu, and also what the government means when it talks about flattening the curve and trying to mitigate or suppress disease. And I think just by explaining a couple of these basic concepts might help you to understand why certain measures are being put in place, including the ones for pregnant women and those for patients who've been looking to get pregnant. So, if we start off with the basic concept of what the coronavirus is, now the term corona doesn't have anything to do with the beer other than the fact that both the virus and the beer are named after a crown. And the reason for this is that the virus, which is essentially made up of genetic material that's in the form of DNA or RNA, is surrounded by a protein capsule, and the protein resembles a crown. So that's the name that this has been given. Now, the thing about how a virus is able to cause disease is in a case like coronavirus, which is spread through respiratory droplets. Every time someone is in close contact with someone and can spread these droplets, or they cough or sneeze, they're able to infect someone else. And they're able to do this because the virus can essentially get inside of the body and start invading cells. So once the virus gets inside a cell, what it does is it takes over its own genetic material and starts to replicate. Now, the virus can't survive on its own. It needs someone like a human. Most usually it's an animal that serves as the host, but in this case it's us, the humans. We're not the natural host for this coronavirus, but it's using us in order to reproduce and to replicate. And it can do this at an incredibly rapid rate. So once it starts to do this and essentially hijack a cell's machinery, what it also does is it creates an immune response in the body, or encourages an immune response, which then creates inflammation. And essentially, the combination of what the virus is doing and our bodies mounting a response is what we experience as disease. Now, when people talk about whether the flu is similar to the coronavirus, there's a couple of main points that I want to get across to you. So, first of all, with the flu, usually the incubation period for the flu is around sort of 5 days. With the coronavirus, it can be anything between 1 to 14 days. Now, the main issue with the coronavirus and why it's affecting people on such a huge scale is the fact that actually this incubation period is very long, and people can be completely asymptomatic for quite a long period of time before they even realize that they have it, during which time they may have gone on to infect lots of other people. So we know from studies that we've done so far and what we've seen that the coronavirus, or someone who has coronavirus, can be infected 12 hours prior to the onset of any symptoms, and around 5 days after developing after developing the infection in someone who's asymptomatic. So if you haven't got any symptoms, but you've actually developed the infection, you can continue to spread that without even knowing it or having a clue that you've actually been infected by the coronavirus. So this is why it's so dangerous and particularly difficult to control. Now, when we talk about how contagious a virus is, we talk about something that's been dubbed in scientific terms as R0, or the basic reproductive number. And what this refers to is how infectious a particular disease is. So, how many people can one infectious person spread this disease to? In the average case of a flu, the R0, or the basic reproductive number, is 1.5. So this means if you've got the flu, you can spread it on average to around 1.5 people in your close vicinity. With something like polio, before the vaccine came in, this number was 6, so it was highly contagious. Now, with the coronavirus, it lies somewhere in between the two. The actual number, or R0, for coronavirus is 2.8. So this is almost double what it is for the average case of the flu. So you can see already that the coronavirus is actually far more contagious than the average flu. And this is again what makes it so difficult and so dangerous in our general society. On the 11th of March, the WHO, or World Health Organization, actually declared the coronavirus a global pandemic. So a pandemic is when we have an infection that's capable of being transmitted on a very sustained level throughout many countries and continents in the world. And that's what the coronavirus has done, as we've seen, with numbers that are rising rapidly as we speak. At the moment, we have no cure for the coronavirus. We're frantically trying to develop a vaccine, and that's the other difference with the flu, that actually we understand the way that most flu viruses behave. We're able to predict how the virus is going to affect someone and the number of people that might be affected. And so this helps us to better prepare for a situation where a flu pandemic might strike. But with the coronavirus, this is a brand new virus that we're not used to seeing. This is the first time that this kind of virus has been seen in humans. It's thought that the natural habitat for this virus is an animal, and most likely the bat. Now, how the virus got from the bat to us, we can't explain. There was probably some sort of intermediate host, but we don't understand enough about it to be able to predict its behavior and how it might go on and affect us. Likewise, we don't understand how the virus might mutate, whether it might mutate for the better in terms of becoming less lethal to humans, but we also don't know whether it may mutate for the worse, simply because it's so new that we just haven't got the science behind it yet. So we are trying to develop a vaccine as we speak. However, it's thought that a vaccine is likely to take at least a year. Whereas for the flu, we do have vaccines which are available. We also have antiviral treatments that we can give, which are helpful in some cases of the flu. With the coronavirus, we don't have any effective antivirals at the moment and no vaccine. So the only way to control this disease is through trying to mitigate spread. And how do we do that? Well, that's through everything you've been hearing about in the last couple of weeks, through self-isolation of people who have symptoms or who have coronavirus. And it's also through quarantine. It's also through self-distancing measures. And actually, we've all now been encouraged to self-distance in order to try and prevent this spread. So when the government talks, or government or epidemiologists talk about something called flattening the curve, what do they mean? Well, we're talking about how this disease progresses and spreads within a population and the burden that it places on us who are affected, but also our healthcare systems. So when we discuss mitigating a particular disease or the growth of a disease, what we're talking about is trying to slow down the climb of that curve. So we're trying to essentially reduce the basic reproductive number, so the number of people that are infected by any one of us who carry coronavirus. And we're also trying to shift the curve as well. So we're trying to push it further so that the number of people who are infected or who develop disease at any given time is on a much smaller scale, so that allows our healthcare systems to be able to cope with the burden of disease that's upon them. Because if the virus was left uncontrolled and we didn't use any measures, what would end up happening is that it's thought about 80% of our population would become infected. And we know currently that actually out of all those infected, around 10% of those will go on and develop acute respiratory distress syndrome. And this is another thing which is also related to the coronavirus. So whereas with the flu, you generally tend to get aches and pains and fevers, maybe some upper respiratory tract signs like coughing and sneezing. With the coronavirus, it's actually thought that aside from fever, the likeliest symptoms are actually lower respiratory tract infections, so things like pneumonia and ARDS, which is acute respiratory distress syndrome. So this is a very severe version of what this kind of virus can do to you, but essentially when it invades your lungs, it can create a huge amount of inflammation that becomes incredibly difficult to control. And because there's no cure, in the hospitals, all we can do is provide supportive treatment to help someone with that. So mitigation is all about trying to reduce the number of people affected by the virus and by the disease at a particular point in time, trying to allow our NHS and healthcare systems to cope with the number of people affected and shifting the curve further and further to try and spread out the number of people affected, to try and spread out the disease. But it isn't about stopping the disease entirely. It involves allowing the disease to essentially run its own course, whereby people will naturally develop what's called herd immunity. So when it's been allowed to run, quite a lot of us, if we've managed to survive and get through it, will then develop immunity, natural immunity. But still, this can take an awfully long time. And actually, because this disease is spreading so quickly, the government, you may have noticed, has started imposing much more drastic measures. So they're essentially now telling all of us to self-distance and to try and stay at home where we practically can. So in essence, what this is doing is moving us away from mitigation phase towards suppression phase. And what does suppression mean? Well, suppression is essentially about trying to reverse the pandemic as much as we can. It's about trying to bring that basic reproductive number, so the number of people that we can potentially infect if we've got coronavirus, down to below 1. And this is incredibly difficult to achieve, and that's why the measures that have had to be taken do seem quite extreme and drastic. But really, it's the only effective way of trying to now suppress the disease. And we're trying to aim to essentially suppress everything by around 66% if we're going to make a difference in terms of being able to cope with this on the NHS. We've all heard about our NHS being and our hospitals being completely overburdened, and you know, in the coming weeks, that's what we're probably going to find, because the projected number of people thought to get ill, and we're using models from Italy and the numbers that they're getting, because we think we're about 2 weeks behind, is something that we aren't prepared to deal with. And that's why, as a result, we're trying to essentially get as many critical care beds as we can. We're trying to get as many ventilators as we can, and we're trying to bring in as many staff. You may have heard that even retired doctors and nurses have been asked to come and help. We're trying to get as many people who are capable of helping into the actual hospitals. But the equipment is the most essential thing as well, having proper ventilators, proper supportive things that we can use on the respiratory wards in ITU to try and help our patients. And this isn't an easy thing. But at the moment, what the NHS has also done is been able to buy equipment and certain beds from private hospitals as well, which is really, really important, just so we have the critical space and the beds to prepare us for the onslaught that's to come in future weeks. And we really don't think we're far from this now. So I hope that me explaining the wider picture to you and what some of these terms like mitigation and suppression mean, and the basic reproductive number, so how infectious a particular disease is, can help you to understand why certain measures being instituted and deployed by the government are so important. And it's really vital that everyone follows this basic advice that we're getting. We've moved away from mitigation, where essentially we've been trying to protect the most vulnerable in our societies. So these have been named as the over 70s, those with chronic underlying health conditions, and those who are pregnant. We've now moved to a point where we're essentially thinking that everyone is at risk of this disease. and everyone is a potential host for the disease as well. And so what we need to do is essentially try and suppress these numbers by instituting these really important measures of self-quarantine if you've got symptoms, if anyone in your family has symptoms or is affected, removing yourself from society for 14 days until you're immune to this, and essentially trying to practice self-distancing from everyone around you to reduce the risk of spread, of you spreading the infection to potentially anyone else and you getting this infection as well. So it's really, really important that we all follow these basic rules, that we understand why we're following them so that we can hopefully try and get through this as much and as fast as we can. At the moment, we don't really know when the end is in sight. We've only just entered the growth phase of that curve and numbers are growing exponentially. So when I talk about how infectious a person can be and that basic reproductive number, if you think about it, if you are a carrier of the coronavirus, then essentially you could be infecting up to, let's say, 3 other people who then go on themselves and infect 3 others. And you can imagine how this number just spirals out of control incredibly quickly unless we take drastic action to try and prevent ourselves from coming into contact, or certainly face-to-face contact, with someone who could be a carrier or where you may be transmitting the disease to them. So please remember to stay safe, to practice the self-distancing, and to try and just bear this out. At the moment, it's thought that we could be in this for 12 to 18 months. Let's hope we can get through it sooner. But, remember, we're all in this together, and just wishing and hoping that everyone stays safe, stays well, and that in terms of our frontline staff and all our emergency staff who are out there helping to look after our societies at the moment, that includes the firefighters, the policemen, the people who are in our stores replenishing everything that's there, and of course our healthcare workers. Please remember the people who are keeping our societies going, and please try and stay at home if you're well enough to stay at home and deal with this yourself. Sending you lots of love.